Hi, I welcome you to this section. Today we'll be looking briefly into a very important aspect that is fundamental for all public health workers, community health workers too, to understand the concept of community health. So we'll be looking at introduction to community health practice. I'm Exa Onyeka. I'm a registered community health practitioner. Hmm, Most times, people do not really understand what community health practice is all about. In some part of the world, it's more rural community practice. Some other developed part of the world, it can be also practiced in the urban communities and other distinct communities. Okay, so we'll be looking at this um, deeply. Community health practice is a part of public health, and both clearly share many features. Both are organized efforts aimed at the promotion, protection, and preservation of the public health. But it really differ. Historically, public health has been associated primarily with the efforts of officials or government entities to abate nuisance, prevent and control pollution, epidemics, by all means for the common good of all. So historically speaking, public health has been there for years and decades and centuries, where people contribute their effort to abate nuisance. And this can be traced back when epidemic was much common and wiping away millions of persons. And most importantly, after the industrializations. So there was a lot of waste products generated and all of that. And this contributed to ill health that people suffered, epidemics, um, though there were presence of diseases that were constantly present, known as endemic diseases then, but epidemics were much common. So, but however, the relationship after several researchers and public health experts looked into this could be the cause of our problem. They now understood that human efforts by way of environmental sanitation and abating of this nuisance, um, changing lifestyles can actually contribute to the reduction of these disease conditions. So public health emanated. But however, community health is the identification of needs, along with the protection and improvement of the health of all within a specific geographically defined area. Okay, so public health has to do with at the public level, and I will tell you that it is communities that make up a public. It is communities that make up a public. So it's more public gets more operational at the public level, whereas inside a public there are communities, different communities. It could be communities of prison, it could be community of one ancient kingdom. So in public, there is communities. So community health practice focus on these distinct communities with their peculiarities, things that are more common with them. And the practice ensures that everyone in that community has optimal level of care, optimal level of health, and is able to live a socially productive life. That it allows them to build on their capacities to live a better life, a self-fulfilling life. So, and this is achieved through the identification of needs along with the protection improvement of the health of all within a geographical defined area. See, community health practice understands that a group usually has a peculiar needs. It could be lack of water, maybe in the historical part, in that of the public health, when public health originated, it was found that it was the tap of water that served that particular community that led to the outbreak of cholera. You see, by the research the expert carried out. So that particular community, their main problem is water because it's essential for life. So, but the water source is not okay. So everyone in that community was affected. You see, was affected. So that is peculiar to that community. Okay. So, however, public health is primarily government-led initiatives aimed at broad health issues like pollution and epidemics for the common good. Okay. However, community health has a unique approach in the sense that it looks at the community needs and utilizes efforts that's localized. So the efforts that's being put in place in community health practice is community specific but of standard. You try to implement initiatives, actions, collective ideas that are scientifically proven to be effective and are evidence-based. But every effort is directed at improving the health of that specific community based on their indices, based on what is common with them, based on their needs. So technically speaking, a community practitioner is a technical expert. You permit me to use that word. Because these sort of healthcare providers will look at the indexes at a particular community, they make meaning from it, they can predict what could be the trend in the next coming years, and they plan ahead to prevent epidemics through interventional programs. So in community practice, you cannot really do much if you don't do research. You cannot really do much if you don't do research. Because in that particular community, on a daily basis, you are the Minister of Healthcare Services. Sorry, you are gathering data. At a point, you notice that the indices are non-normal or they are becoming abnormal. You begin to look at what could be the possible cause and what can happen in the next 5 years or in the next 1 year or in the next 6 months if nothing is done. You predict. So that leads to community health indexes. So community practice looks at it from technical aspect. They look at it because they are surveillance. They look at it, they continuously carry out this surveillance activities because they're looking at the trends over time so they can predict, yes, this is likely what's going to happen. So, and there's a peculiar thing about this practice, and that is community diagnosis. And with the effective tool of community mobilization, situation analysis, what is actually happening in this community at every point in time? What is the situation of things in this community at this point in time? Situation analysis. How many hospitals? How many police stations? How many markets that can have impact in the people's life? People need to eat to live healthy. Children must go to school for them to learn. So when they go to school, what is the likely healthcare available in that particular school, in that particular community? If there is, who prepares this food? Is the food actually prepared in an ideal environment? So this is what the community health practitioner looks at. So when he makes carries out his diagnostics, community diagnosis, he looks at the situation analysis. He thinks that something might really be wrong with this if something is not done. He goes for collaboration. He begins to engage stakeholders See, look at what I found out from my studies, because already our population is 1 million, our population is 30,000. And if we don't use family planning, for an instance, I'm trying to hypothesize now, if we don't use family planning, we might likely going to have overpopulation. And considering the limited resources we have in this community, because they have done a situation analysis, what is on ground, number of hospitals, number of primary healthcare facilities, total number of healthcare workers that's available in that community or working in the healthcare facility, both those being paid by the government and those on private practice. So, and he looks at it, if we do not do immunization, there is going to be an outbreak. And when this outbreak happens, they are going to overpower the available resources, because we just have only one health center. The next referral is a bit about 2 hours drive, and we don't have ambulances available. So we are going to go into immunization on the fly. So a community practitioner is a technical officer. So they look at it, they look at data. All of this is just peculiar for this particular community, so that everyone will have the opportunity to live a socially productive life, where social barriers such as inequalities are being reduced. Of course, there will always be inequality, but that of the social inequality should be reduced. So that is what a community practitioner looks at. That's what the community practitioner thinks about. Clinical wise, public health wise, and community health wise. So now, in a nutshell, public health has to do with the focus of the public level. And I tell you that in every public, there are communities. There are communities that is in every public. So community health is a bit not really more different from public health practice, but it is a practice within a specific community. And that community can be conventional communities or all the unique communities we're having in. It could be community of HIV patients. Yes, of course. Those patients, they need to live a socially life that is not limiting them. They need to live a socially productive life. So someone is going to look at their psyche, how are they really coping? Someone going to look at their nutrition. Someone going to measure their attributic measures. Someone going to look at them. Someone going to plan for them. Someone going to think about them. So that's also community practice all about. And everyone, community health, everyone is adjudged by the level of community, by the level of health in that particular community, sorry. So that's what community health is all about. Now, who is the community? Or what can we say about community? Community is broadly defined as a collection of people who share some important features of their lives. So when we understand community now, we relate it to community practice. I've just discussed with you that what a community practitioner does in a particular community. And indeed, there will not be any community, there will not be community practitioners if there is no community. So that's what we want to look into. What is community? I'll just say that community is broadly defined as a collection of people who share some important features of their lives. In this text, or in this context, let's just look at that. It refers to coalition of people who interact with one another, who common interest or character form the basis for sense of unity or belong. So these people belong together. They see themselves as one in that particular community. A community can be a society of people holding common rights and privileges. Egypt, it could be citizen of a particular town. Yeah, it's a community. Also, a community can be people who share common interests, like farmers. It's a community of farmers, right? They have concerns, they have needs. Yes, they have concerns, they have needs, they have problems, they have felt things, they have real needs. So they need to, so there's need for us to go in, look at it. What is the problem? What is situation analysis? What is the situation on ground? Then we can do diagnosis. Okay, this is the actual problem of this community. Then you look at it, and once it's been solved, the problem of that community is solved. And for that moment, and you see their health indices of that farmers progressing. It could also be people who are living under same laws and regulations. For example, prison community. Yes, they have common laws and regulation. So in a particular community, it allows people to have a collective sense of belonging. If you look at all the criteria, we say community can actually be known or related, you see that it's this set of persons, let's say people who have common interests, like the community of farmers, they have a sense of belonging that we are farmers. For communities that are abide by laws, regulation, or bounded by laws and regulations, sorry, they feel that they belong to that. If you go to prison or a rehabilitation center, they see themselves as one in that particular community. So community give every one of them, every person, that sense of belonging. And they have a shared identity, values, norms, and they tend to communicate. And they have a common interest. For farmers, the interest is to make sure they have good yield. For people in the community, or sorry, the community of prison, or for people in the prison community, they have a common interest, and that is to rehabilitate, reform, and all of that. And every one of them want to leave to go back to the society to reintegrate. So, in a nutshell, we've understood what community, we give an understanding of how public health is different from community health slightly. We look at what community health is all about, we look at the technical part of it and their work. Then we've also looked at what a community is all about. So, but let's now talk about the features of community health practice. Community health practice places a lot of emphasis on awareness of all members. Yes, it places a lot of emphasis on the um, wellness of all members. No one is excluded, all members. And that is promotive care. So community health tends to use promotive care as one of the tools for solving the problem. So everyone to be well in that particular community is one of the core mandate of a community practitioner. And community health tends to achieve promotive care by incorporating and improving the capacity of everyone in that community to lead a fulfilling and productive life. And when we mean a productive life, a life that's of quality. So that is one aspect. So also community practice tends to also adopt preventive care. Preventive care, and this is provided at different levels. It is provided at different levels. It could be primordial, whereby a community practitioner sits down and makes sure that people under his care in that community are not exposed to risk. They don't develop the risk. So they tend to engage in health education, teach people what they need to know so that they can avoid risk that can put them at higher chances of coming down with a particular condition or being exposed to hazard. So they achieve that through health education as one of their key strategies. That's at the primordial level. Then also that we're talking about preventive tool they use. Then at the primary level, when they notice that the community have been exposed to risk, maybe by way of living in a particular geographical area, for reasons of nature, or maybe the area is too mountainous or so water that there's nothing you can do. Yeah, by the way of being born in that particular place, you're already exposed to that risk. They tend to adopt another preventive level, that is primary preventive level. So at this level now, they're already the community practitioners. They now plan, project themselves into the future, and look at, we are already exposed to risk. They begin now to talk to people about health education, preventive practices, so that even though they are exposed to the risk, they wouldn't come down with the sickness or hazard affecting them. They begin to look at mitigative measures. How can we really prevent these people from coming down with this condition, even though they're already exposed? Another level of prevention to the adopt in the community. So if the persons also may have come down with the condition, they move to the next stage, secondary preventive strategies. And now at this point, they have now understood that these people have come down with this condition. They now in efforts to detect and treat these health problems at the earliest possible stage, when the disease or the impairment is already at the earliest stage. So you see, now they begin to initiate screening for HIV, screening for malaria, screening for whatever, to know, oh, these people are already with this condition. And that's the data they are getting, they're using to plan ahead. Then if some persons in the community have progressed beyond, or we are not able to be detected by the strategies at a secondary level of preventive tool, they now move to the tertiary level and until they reach the quaternary level. So communities adopt this promotive tool where they improve people's ability to actually prevent themselves or reduce their chances of coming down with disease condition. Through promotive activities, exercise programs, lifestyle, healthy lifestyles. They also adopt preventive tool where they look at, could be at the primordial level, it could be at the primary level, it could be at secondary level, it could be at the tertiary level or quaternary level. Another thing that is you would know about community health is it's a domiciliary care. These people are the first contact because they live with the people in the community. The practitioners are resident in the community and they are part of the community. So they are the first to be reached. So that's the one thing you should know about community health practice. Another feature is that there is quality assurance in what they are doing. Community practice promotes quality assurance of health services, which they provide to individuals, family, and communities at large. Because a community practitioner will always collaborate with community leaders in preparation of a community emergency preparedness plans in high-risk areas. Like I told you earlier that these people, this professionals sit down, project themselves to the community, to the future, and say, this is likely what will happen if we don't. Or maybe for the reasons of seasonal variations, like we said, you are already exposed, that community is already exposed as risk. Community practitioner helps that community to develop contingencies, plans, and This ensures that plans are of quality, integrated, that people understand, and they are based on proven scientific models. Then quality, holistic care. So a community practitioner provides physical, emotional, social, and spiritual um, support, psychologically. So the care they provide is not just only about clinical care. They take care of minor conditions. They do health screening, promotive care, social medicine. They engage in preventive healthcare, health education, and they are data analysts. They look at data, they make meaning from data. From there, they can actually predict what could happen in the nearest 5 years, 1 year, 6 months, and this way they're able to navigate the people. They also help the people navigate through the levels of healthcare, becoming the most important because the community people trust them because they live with them. So if they look at this condition need to be referred to tertiary level, it help the mothers, the children, the adolescents, the elderly ones to navigate through the healthcare system, especially in Nigeria, where we have the primary level. They're mostly domiciled at primary level. Sometimes you might see them at the secondary level. Then help those people, that particular community that are serving, to navigate through all the levels of healthcare system and follow up to make sure that everyone is healthy and everyone lives a productive life. And the life they live is of quality. So everyone is carried along in community practice. No one is left behind. Even if they're blind, crippled, deaf, dumb, and told who have abnormalities or chronic conditions, a community practitioner thinks about you. A community about to project themselves into your future to make sure your health aspect of your life is in good shape so that you can have every opportunities to compete with others so you can attain a quality of life, a productive life. So that is what community health practice in a nutshell it's all about. Thank you.